told you AI is about to completely change something we don't usually think of as cutting edge. Like when we think high tech, medical imaging isn't usually the first thing that pops into our heads, right?
Right.
But it's the foundation of so many diagnoses, and it's ripe for a revolution.
I feel.
And that's exactly why we're doing this deep dive to explore SLIViT,
Yes.
a game-changing AI model from UCLA
Yeah.
that could reshape healthcare as we know it.
Huge implications.
Now, you might be thinking, okay, so how does this impact me?
Right.
It's a great question because whether you're a doctor or anyone else, really,
Yeah.
the promise of faster, cheaper, and incredibly accurate diagnoses affects all of us.
Absolutely. And you see medical imaging, like when we're talking MRIs,
Right?
CT scans, even retinal images. Those are essential for diagnosing so many conditions. They give doctors that crucial look inside.
Yeah, a window into the body, basically.
Exactly. But there's always been a bottleneck. Analyzing these 3D images takes time.
Right.
A lot of it.
Yeah, I can imagine.
And you need the expertise of highly trained specialists. And in healthcare, we know time is often critical, so delays can have serious consequences.
Absolutely.
That's where SLIViT steps in.
Okay.
This AI can analyze those complex images way faster.
Yeah.
We're potentially talking about shrinking a process that took hours down to minutes.
Wow.
And this is key without sacrificing accuracy.
Now that's what I call impressive. Just imagine what this means for patients, for wait times.
Right.
Especially in areas where specialists might be hard to come by.
Absolutely. A huge issue.
This isn't just about efficiency. It's about making good healthcare accessible to way more people.
It is. It really is.
Remarkable stuff. But before we get ahead of ourselves, how does SLIViT work? It almost sounds too good to be true.
Well, it's definitely really cool. It uses a deep learning framework that basically means it learns by processing mountains of data, in this case, medical images.
Right. Makes sense.
But here's where it gets really clever. Instead of relying only on those complex 3D scans for its training, which, by the way, are much harder to get a hold of, SLIViT starts with more readily available 2D images. It's like, imagine learning the basics from a textbook.
Okay, I get that.
Then, once it's got a good foundation, it sharpens its skills with those detailed 3D scans.
So it's like mastering the nuances in a hands-on workshop after you've aced the textbook part.
Exactly. And this approach makes its development and implementation much more cost-effective. This potentially opens doors to using it in way more healthcare settings. Major hospitals, sure, but also smaller clinics, places that might not have the resources for more complex systems.
Right. So it's like leveling the playing field in a way.
That's a great way to put it. It's about democratizing access to this kind of advanced analysis.
That's amazing. But this brings up another question. Is SLIViT a one-trick pony? Can it only analyze one type of scan, or is it capable of more?
Oh, it can do way more than just one thing. That's where its transfer learning abilities come in.
Oh, wow. Tell me more about that.
So it's not limited to a single type of scan. It can take what it's learned from, say, analyzing retinal images, and then apply that knowledge to something totally different, like MRIs of the liver.
Wow.
It's like having a medical student who, after mastering one medical field, can grasp the complexities of another really quickly. That adaptability opens up so many possibilities.
That's incredible. One AI with the potential to contribute to diagnoses across multiple specialties.
Exactly, and that's a game changer.
Talk about streamlining workflows. I'm guessing this could also mean we'd rely less on tons of different software programs.
For sure.
Each with its own learning curve.
Exactly. And you know what? It even goes beyond just identifying a disease.
Oh, tell me more.
You know those biomarkers we hear about?
Yeah, I've heard the term, but I could definitely use a refresher. What exactly are biomarkers in this context?
They're like, think of them as clues hidden within our bodies,
Okay.
and they're found in our blood,
Right.
our tissues, even in the medical images we've been talking about.
Oh, interesting.
And they can indicate all sorts of things. The presence of a disease, how aggressive it might be,
Wow.
even how well a patient might respond to a specific treatment.
Okay, so they're like super personalized health data points,
You got it.
offering more insights than a standard scan could.
Absolutely.
Yeah.
And the exciting part is that SLIViT can analyze these biomarkers too.
Wow, so it's not just looking at the picture, it's analyzing the underlying information too.
Exactly. This is what paves the way for what we call personalized medicine,
Okay.
a future where treatments are tailored specifically to you, based on your biology, based on what your scans reveal. It's like completely customized healthcare.
Wow, that's incredible. It's like having a treatment plan designed just for you.
Precisely.
Maximizing how well it works, minimizing side effects. Now that's the future of healthcare.
Right. Imagine cancer therapies fine-tuned based on the molecular profile of your tumor, all revealed through your scans. Or imagine doctors being able to predict your risk of developing certain diseases and then intervening before they even become a problem.
It's like we're stepping into a science fiction movie, but it's real. It's remarkable.
It truly is. It makes you wonder, if AI can already do all this, what else might it be able to do in healthcare in the years to come?
That's a question worth thinking about. It speaks to just how fast things are moving in this field. But let's bring it back down to earth for a moment.
Right.
For those of us who aren't medical professionals, what does this all really mean? What's the big picture impact of SLIViT and AI like it?
It means expert-level diagnosis anywhere in the world,
Wow.
regardless of whether a specialist is there in person or not.
So it's bringing that expertise to the patient, not the other way around.
Yes, exactly.
And especially in areas that don't have the same access to top-tier care. That's huge.
It's huge. Imagine a small clinic, maybe in a village somewhere, having the same capabilities as a major hospital in a big city.
Right.
That's the kind of future we could be looking at with SLIViT.
It's like democratizing that medical expertise, right? Using AI to level the playing field so everyone has a better chance at getting a proper diagnosis.
Exactly. And there's another piece to this that's really exciting. SLIViT is designed to keep learning and keep adapting.
Okay.
So as new medical imaging technologies come out, SLIViT can evolve too.
So it's not static, it's constantly learning and growing and becoming even more sophisticated over time.
Exactly. It's like having an expert who never stops learning and refining their skills.
Wow. That's pretty incredible. It offers a glimpse into a future where AI isn't just a tool, it's more like a partner in improving healthcare for everyone.
Exactly.
Amazing.
Okay.
It's incredible to think about all the possibilities. If AI can already analyze images and biomarkers this well, what else might it be capable of in healthcare? That's definitely something to think about.
It really is. The potential is massive, and we're just scratching the surface.
Well, on that note, we'll wrap up this deep dive into SLIViT and how it could completely change medical imaging. We've talked about how this AI is making diagnoses faster, cheaper, more accessible, and how it could even lead to personalized medicine. It's an exciting time to be talking about the future of healthcare.
It really is.
And we can't wait to see what breakthroughs come next. Thanks for joining us.
It means that expert-level diagnostics could become accessible anywhere in the world,
Wow.
regardless of whether a specialist is physically present.
So it's bringing that expertise to the patient, not
Yes.
the other way around.
Exactly.
And especially in areas that don't have the same access to top-tier care,
Yeah,
that's huge.
it's huge.
Yeah,
Imagine a small clinic,
right,
maybe in a village somewhere,
right.
having the same capabilities as a major hospital in a big city. That's the kind of future we could be looking at with SLIViT.
It's like democratizing that medical expertise, right?
Yeah, exactly.
Using AI to level the playing field
Exactly.
so everyone has a better chance at getting a proper diagnosis.
And there's another piece to this that's really exciting.
Okay.
SLIViT is designed to keep learning
Okay.
and keep adapting.
So it's not static.
Right.
It's constantly learning and growing and becoming even more sophisticated over time.
Exactly. It's like having an expert who never stops learning and refining their skills.
Wow, that's pretty incredible. It offers a glimpse into a future where AI isn't just a tool.
Right.
It's more like a partner
Yeah,
in improving healthcare for everyone.
exactly.
Amazing. It's incredible to think about all the possibilities. If AI can already analyze images and biomarkers this well, what else might it be capable of in healthcare? That's definitely something to think about.
It really is. The potential is massive, and we're just scratching the surface.
Well, on that note, we'll wrap up this deep dive into SLIViT and how it could completely change medical imaging. We've talked about how this AI is making diagnoses faster, cheaper, more accessible, and how it could even lead to personalized medicine. It's an exciting time to be talking about the future of healthcare.
It really is.
And we can't wait to see what breakthroughs come next. Thanks for joining us.
It means that expert-level diagnostics could become accessible anywhere in the world. Wow. Regardless of whether a specialist is physically present.
So it's bringing that expertise to the patient rather than the other way around.
Exactly.
Especially in areas that lack access to top-tier medical care. That's a game changer.
Precisely. Imagine a small clinic in a remote village having the same diagnostic capabilities as a major hospital in a bustling city.
Right. I see what you mean.
That's the kind of future SLIViT could help create.
It's like democratizing medical expertise, using AI to level the playing field and offer everyone a better chance at a proper diagnosis.
And here's another exciting aspect. SLIViT is designed to constantly learn and adapt.
Okay, so it's future-proofed in a way?
Exactly. As new medical imaging technologies emerge, SLIViT is well positioned to evolve alongside them, staying at the forefront of this AI revolution.
So it's not a static piece of technology. It's continuously learning, growing, becoming even more sophisticated.
Exactly. It's like having a medical expert who constantly expands their knowledge and refines their skills, always learning the latest breakthroughs.
That's fascinating. It really highlights how AI is changing the landscape of healthcare.
It really is. It offers a glimpse into a future of medicine where AI isn't just a tool, but a partner in improving healthcare for everyone.
Not replacing doctors, but working alongside them.
Precisely. It's about augmenting human expertise, not replacing it.
It's incredible to think about all the possibilities. If AI can analyze images and biomarkers this well, it really makes you wonder what other aspects of healthcare might it transform in the years to come. That's something to ponder, isn't it? This deep dive has certainly given us a lot to think about.
It certainly has. The potential for AI to improve healthcare is vast, and we're only just beginning to explore its possibilities.
Well, on that note, we'll wrap up this deep dive into the world of SLIViT and its potential to revolutionize medical imaging. We've explored how this AI is making diagnoses faster, more affordable, and more accessible, all while paving the way for a future of personalized medicine. It's an exciting time for the future of healthcare, and we can't wait to see what breakthroughs come next. Thanks for joining us on this journey.